Starting right now.
Good afternoon, everyone. We're just going to give it a few minutes or a few seconds for everyone to filter in from the waiting room, and then we'll get started. All right, I'm seeing the waiting room slow down, so I will go ahead and get started. Thank you for joining us today for Trauma-Informed Response to Serve Drug-Endangered Children during COVID. My name is Charlotte Hoff, and I am a Communications and Training Coordinator at MOVA. I'm just going to go over some logistics quickly before passing it over to our presenters. This is a Zoom webinar, so you cannot be seen or heard as audience members, but you can see the presenters and the presentation. There will be time at the end for questions. If you have questions, please use the Q&A function to submit those, and we'll get to all of them at the end. If you're having any tech or logistics issues throughout today's presentation, please message myself or my colleague, Brenna Chase, and we'll be happy to help you. And if you don't see our names in the chat option, you can just message all panelists. We'll see your message and we're happy to help you from there. I'm excited to introduce today's presenters, Plymouth County District Attorney Timothy Cruz and Melinda Neeland, Executive Director of the United Way of Greater Plymouth County Family Center. Thank you both for being here and presenting today. I'll now pass it over to you, DA.
Good afternoon, everybody. I hope everybody's doing well. Before I do get started, I'd like to take the opportunity to thank MOVA and Executive Director Liam Lowney, because I appreciate the efforts in organizing today's event. They're not always easy, I know that. I want to thank all of you for your many years of advocacy on behalf of crime victims. I respect MOVA's vision for a state where all victims and survivors of crime can access rights and high quality services and have their voices heard and valued. That same vision is something we work towards every day here in Plymouth County. Our office works tirelessly to pursue justice, and justice is really about building unified and healthy communities. We understand our role as prosecutors, but hold ourselves to the highest standards of fairness, integrity, and loyalty to the communities that we serve. I've been the chief law enforcement official here in Plymouth County for over 20 years. Like other DAs, I have a variety of responsibilities, most of which occur inside of a courtroom. But what many people don't know about our office is all of the work that we do to prevent issues from ending up in a courtroom. One of these includes working to create a safer community for our kids, and our work is ever evolving. At the end of the day, our job is to protect the community, and the best way to protect it is to ensure the healthy development of the next generation. It is imperative that we invest in trauma-sensitive best practices. During my time as DA, I've made trauma sensitivity and the education of adverse childhood experiences a priority. Over the years, we've dedicated our time and resources to implement trauma-sensitive trainings for schools and police. We partner with agencies like the United Way to help the kids in Plymouth County build resilience. And I'm so pleased to share what we've learned over the years, particularly this year as we adapt to the pandemic. This project has always been able to adapt to the needs of our community, and this year was no different. As you'll see today, we started in a few schools in one city discussing children who witness violence. Now, more than 15 years later, this is a countywide effort to address all instances of childhood trauma. Progress starts with education and awareness, and I hope that you find our presentation today informative and practical. Our goal is to help educators, police officers, victim advocates, hospitals, and service providers to keep the tools in their toolkit sharp. For more information, I encourage you to visit our website, Handle with Care Massachusetts, at hwc.plymouthda.com. I want to thank you in advance for all the work that all of you do every day to make the Commonwealth a safe and supportive environment for our kids to learn and grow. And I'm honored to be here today to join Melinda Neeland. Melinda is the Director of Community Connections of Brockton and the Family Center, which is a program of the United Way of Greater Plymouth County. We're very lucky here in Plymouth County because there's no better advocate for kids and families in our county than Melinda, so I thank Melinda. Plymouth County is really not that different than the rest of the Commonwealth, and that we've all been hit hard by a lot of problems, including the opioid epidemic. A few years back, we had a watershed moment during one of our focus groups with school nurses. We asked them their thoughts on the news that a group of their former students, now kids in their early 20s, were all overdosing. The nurses agreed that schools and communities were not doing enough to help students develop proper coping skills. Students with anxiety, depression, loneliness, and stress were graduating without ever learning how to self-regulate properly. Instead, self-regulation came in the form of smoking a blunt, drinking a beer, in some instances popping pills. There was something bigger in life that they were dealing with, and no one was addressing it. Anxiety, stress, coping skills, self-regulation. In Plymouth County, we've been down that road before. We all looked at each other and said, you know what? It's time to resurrect the Helping Traumatized Children Learn model. And so now just a little history of how we came to where we are today. About 15 years back, there was an incident in Brockton where a drug deal had gone bad. Instead of ripping off the third floor apartment building, several armed men entered the second floor, not the third, where a mom and her kids were living. The oldest child was about 12 years old. He tried to stick up for his mom. Everybody was yelling, being pushed, guns were drawn. And eventually the gunman ran away. They'd been in the wrong place and the family was left alone. But they were filled with anxiety, fear, and of course, trauma. The very next morning, after all that happened, where do you think the kids go? The kids went to school. Now, I don't know about you, but when I was a kid, I thought all the adults in my life talked to each other. So did these kids. But when they showed up to school, nothing. Nobody asked them how they were feeling. Nobody asked them how their mom was, or if they could help them. It was unreported and untreated trauma. Our office learned about the incident and worked with the Brockton Public Schools to come up with a solution. We came across the Adverse Childhood Experiences, or ACEs study, that was done in the 1990s by Kaiser Permanente. And at its roots, the ACEs study says the more ACEs a kid has, like physical or sexual emotional abuse, a parent in jail or with a substance abuse disorder, or witnessing violence, the more at risk that child is to develop health and social problems. But the ACEs study was only half the battle. We needed to know how to help the kids with ACEs. So in 2007, we partnered with the Trauma and Learning Policy Initiative, a partnership of the Mass Advocates for Children and Harvard Law School. And thanks in large part to the leadership of Sal Tracy at the Brockton Public Schools, we quickly developed a training not only for educators, but for principals, paraprofessionals, counselors, administrative staff, and even custodians. We trained police in how to incorporate trauma-sensitive tactics when responding to incidents involving kids. We had social workers ride along with the Brockton Police as well. We studied best practices out of OJJDP and the Boston Medical Center, and we tried to replicate strategies already incorporated by Yale University and the New Haven Police Department. Previously, when police responded to an incident and a child was involved, that child's information was passed along to their school. We called it the red envelope. But when we trained the state of West Virginia, they renamed it Handle with Care, which name we in turn adopted. So the school receives a notification from the police department, like you can see here in this slide, and that says Johnny Jones, Handle with Care. And that's it. We piloted this program at 3 schools in Brockton. After receiving trauma-sensitive training, the pilot schools saw an 80% decrease in suspendable issues and cut their office referrals almost in half. In collaboration with the Brockton Police, these Brockton schools were learning which kids were experiencing trauma as a result of ACEs, and the schools were prepared to work with these kids as soon as they walked in the door. In an effort to better educate ourselves and our partners, we've always valued data collection. Sheriff Joe McDonald and I made that a priority when we created the Plymouth County Drug Abuse Task Force back in 2015 to combat the opioid crisis. We want to be a clearinghouse of information for our communities. Here are some examples of different data sets and heat maps that we were able to collect. This helps us go to the schools and say, even if a child is not identified as Handled with Care, your students live in these neighborhoods, and this is what they're witnessing. You should be giving everyone a dose of trauma sensitivity. Here are all the community ACEs your students are facing. 2 resources that our offices use in helping traumatized children learn is the Purple Book, as we call it, and the OJJDP Enhancing Police Responses to Children Exposed to Violence. Over the years, We've used grant funding to purchase these toolkits and get them out to as many educators and police officers as we can. Now, by no means am I an expert in trauma, and I don't have a PhD in education, and I am not a police officer, but I can use the resources of our office to help those who are. We want to have the most up-to-date best practices available. We do trainings, we do roll calls, and we distribute books. We do whatever it takes. Here's a short video from East Bridgewater about how their town has implemented Handle with Care, or they refer to it as Kids in Need. This is retired Police Chief Scott Allen and Assistant Superintendent Gina Williams. Across the board, you see police officers, teachers now, talking on a different level. Again, we're very cautious. We share limited information, but we're just letting one another know, hey, we're having situations with families. If I talk together, now we can get a better strategy to help.
Hey, Mr. Cruz, we weren't able to hear the video. The audio was a little cut off. Do you want to maybe just summarize what Scott and Gina were talking about, or would you like me to summarize it?
Yeah, you can summarize and you go on, Melinda.
Okay. So really, Chief Allen and Assistant Superintendent Williams were talking about the collaboration between the schools and the community and what law enforcement sees when they respond to homes and how that impacts how the student is received the next day in the classroom. And so Gina really speaks to, from the school's perspective, the more information they have, the more better able they are to support kids compassionately days following a traumatic event. And then they're able to link families to the appropriate supports, such as, our DEC team or family resource centers, which you're going to hear a little bit about later.
Great. Thanks, Melinda. So again, like Melinda just said, just to summarize, before Handle with Care, there was no follow-up. Police may have filed 51A and they may write a report, but then what? These kids were showing up to the school and there was no continuum of care. Now with Handle with Care, we'll fill in those gaps and the children are being connected with the appropriate services. So let's flash forward to 2015 and the opioid crisis. In 2013 and 2014, we started to see an uptick in heroin overdoses. I'm sure most of you followed a similar timeline. We focused originally on increasing accessibility to Narcan. We tried to improve drug education in our schools. We increased enforcement to cut down the supply, but once again, something was missing. We were just scratching the surface level. We were not drilling down deep enough. So in 2015, Sheriff McDonald and myself brought all the key county-wide stakeholders into the same room and said, okay, we need to figure this out. The hospitals and schools were doing their part. The police were working hard, but there was no coordinated response. There was no county-wide plan to address the opioid crisis. So we created the Drug Abuse Task Force as a way to serve as the clearinghouse of information and resources. Our task force consists of all 27 Plymouth County Police Departments and state universities in our county, our hospitals, the FBI, the U.S. Attorney's Office, faith organizations, local community prevention coalitions, treatment centers, parent support groups, and advocacy groups. It's that diversity of representation that allows for different voices to be heard, different needs to be addressed, and ultimately a more holistic response. In addition, we receive grant support from the state and federal governments, including from the Office for Victims of Crime, which has allowed us to fund different initiatives of the task force, including the Drug Endangered Children's Initiative. One of the first projects to come out of the task force was Plymouth County Outreach, or PCO for short. In a nutshell, all 27 police departments and hospitals in our county have committed to working with the recovery community to provide immediate resources to our overdose victims. So within 24 to 72 hours of an overdose, an outreach team, which consists of a plainclothes police officer and a recovery coach, conduct home visits of overdose survivors. The intent of the outreach effort is to provide resources and support the SUDS individuals with the hope of getting people into treatment and connecting the family and friends with existing resources. Oh, and hopefully you can hear this better, but here's Plymouth County Police Chief Mike Botteri discussing PCO.
A few years back, I think everyone realized we saw this epidemic. Overdoses just shot through the roof, and right down here in Plymouth, we noticed it as well. Back in 2014, our numbers went up. We had somewhere around 120 overdoses. That a few years back, I think everyone realized we saw this epidemic. Overdoses just shot through the roof, and right down here in Plymouth, we noticed it as well. Back in 2014, our numbers went up. We had somewhere around 120 overdoses that year, and now we're up to a little over 200.
Well, it appears we're having some difficulties with
So
Chief
a
Botteri.
few years back, I think everyone.
So, I mean, so basically what he, in summarize what the chief has said is that basically is that, you know, we have PCO, Plymouth County Outreach, and I know often when we put this together, it was a real challenge in getting all 27 of our communities together. And the police chiefs have been very hard workers in sharing information as to what we can do to make sure we can get those resources to the people who need it most in our county as we're dealing with that. So one of the benefits of PCO has been the robust data collection. You know, and as it relates to today's conversation, we started to get a glimpse into how many children are either witnessing overdoses or living with someone who had a substance abuse disorder. One of the first data points we started to look at was where were the overdoses occurring? In Brockton, 65% of overdoses were happening at home. So that old myth of the 50-year-old heroin user overdosing in the McDonald's bathroom or some back alley just wasn't the case. These were victims, and in many cases, parents were overdosing at home. Part of the enhanced data collection started to include heat maps of the areas in our county with the highest density of overdoses. The majority of the overdoses also during the uptick were people between the ages of 20 and 39, parenting age. Many of them had young kids. In 2018, our police department started tracking whether a child was present at a scene. 72 children were present at the scene of an overdose, and 80 overdose incidents involved people associated with school-age kids, a parent, older sibling, a relative, somebody who lived in the home. In 2019, those numbers increased. And I attribute that to better reporting, but even still, I believe these numbers underestimate how many drug-endangered kids are present in overdoses. Keep in mind that this is just police reporting. Children living in a home with substance abuse issues, but no 911 calls, they go unnoticed in these numbers. Beginning last year, one of our goals was to look at either entry points where we could identify drug-endangered kids, like our 4 drug courts, faith communities, and child protective services. This served as the impetus to our Drug Endangered Children Initiative, DECI. Our overdose numbers are starting to plateau, and in some instances, they even decrease. But our next challenge is going to be dealing with children in our communities who have been exposed to the opioid crisis at home. The effects on them are long-term, and we need to get people to understand the concept of drug-endangered kids. To think about what these kids are seeing at home, what they are carrying with them when they walk into school in the morning. To think about the trauma and the ACEs, and we started to make that connection. This child who's calling 911 because their parent overdosed in the bathroom is really not any different than the kids we heard earlier about the home invasion. What we kept coming back to was the idea of kids who see too much, kids who have trauma, kids who have ACEs, and how are they dealing with those ACEs? Are schools helping them self-regulate, or are these kids turning to drugs to continue that perpetual cycle that we need to get in front of? The issue is twofold. Substance abuse use in the home is becoming a leading adverse childhood experience that kids in our county are dealing with every day. And 2, ACEs like substance use in the home are putting children at a greater risk for developing their own addiction later on in life. So we developed the Drug and Endangered Children Initiative, using what we had learned all those years ago with the Trauma and Learning Policy Initiative and our work here in the city of Brockton. I am so grateful for our partnership with the United Way Family Center. Now I'd like to turn it over to Melinda Nealon to talk further about our Drug and Endangered Children Initiative. I want to thank you all for the job that you do every day and the people that you work with in making our lives and our communities better. Thank you so much.
Thanks, Mr. Cruz. If you guys can just bear with me for 1 second, as a result of the pandemic, we are in different locations. So I'm just going to share my screen now. It'll take me 1 minute. All right. Can I just get a thumbs up, Charlotte or Brenna? Are we in good shape? Can you see my screen?
You're good to go.
Awesome, thank you. So you just heard from Mr. Cruz about kind of how we got to where we are, and we very much talk about how data drives the interventions that we form. But the other key factor in how we develop our programming is really led by kind of scaffolding the resources and the support on what's already worked. We don't want to reinvent the wheel, and so we really came alongside Plymouth County Outreach and our recovery communities within Plymouth County and across the Commonwealth, and leverage the localized expertise of the folks that were already on the ground interfacing with individuals and families impacted by substances. And so we're going to talk a little bit about how we developed our programs and rolled them out prior to the pandemic, and then how we had to adjust moving forward. Another fun fact, right? So that we're not professional presenters here. We're really just boots on the ground doing the work alongside families. And so bear with me if I make any mistakes as I move through the slide deck. But our first goal was really enhancing the capacity to serve our children and families in the county and strengthening the DA's task force. You know, he talked earlier about our drug abuse task force in partnership with the Sheriff's Department and how folks were getting together as they identified the needs to combat the opioid epidemic. It was pretty clear by what was happening in our county and fatal and non-fatal overdoses that this is not a problem folks could arrest their way out of or prosecute their way out of anymore. And so we really needed to get creative, get together with our local stakeholders and develop a system of care to serve kids and families differently. And so you'll see here, these are some of our key partners. And then the other question we ask at every meeting is who's missing, who should be at the table. And so our subcommittee of the DA's task force continues to grow over time because we want to be as inclusive as possible and really be informed as we're developing our interventions for the community. So our goal number 2, right? We want to increase capacity. In the first goal, we want to increase awareness of the impact and the needs of kids and families. And the way that we tackled that was really through training and technical assistance. And we knew that there were great models out there, evidence-based practices, promising practices that folks were utilizing to kind of tackle this at multiple levels. We're talking about at a family level, working with kids and families and caregivers. We're talking about it at a stakeholder level, working with schools and law enforcement, fire and EMS, churches and community members. And we're talking about it at a state level. I'm really engaging the folks that do advocacy work every day to bring best practices to our community. And so this is one of the reasons why we're really excited to be here alongside all of you presenting this information today, because the more conversations we have about our model and about how it impacts kids and families in our community, the better that we can support our kids and families. And so in our training and technical assistance model, you'll see here a list of partners that we've brought alongside the work that we're doing here in our county. All of these slides will be available after the presentation, and in each of these highlighted in blue is actually a hyperlink that will bring you to the model and to the organization that provides the work. A couple of key folks that you've already kind of heard about was really the Helping Traumatized Children Learn model through the Trauma and Learning Policy Initiative. You've heard a little bit about kind of National DEC, where we trained law enforcement on how to identify kids associated with the scene and then how to de-escalate the scene, the child and the family, so that we're reducing the amount of trauma and the stress responses associated with that, because law enforcement is better able to kind of support kids and families on the ground. And then their communication with schools is covered under Handle with Care. And we are super grateful for our partners out in West Virginia who took this great idea and operationalized it into a practice that could be scaled up and spread across the country. And so because of their work, we're able to kind of really better engage our schools and law enforcement, fire, and EMS to provide a traumatic or an awareness, right, and a trauma-informed response to kids and families as they're serving the community. Another group that we partnered with is our Children's Advocacy Center to build localized capacity of facilitators in a model called Word on the Street. One of the things that we learned is that there are so many interceptors, right, around adverse childhood experiences and so many places in which we look at the experience of kids and families in our community where they've been left vulnerable. And exploitation is a huge focus area for us. We want to build the skills for kids and families to identify healthy relationships, to avoid the traps of trafficking, and to really be more aware of the risks, especially in this time of the world of technology. Our kids are at greater risks every day as a result of this. And so we partnered with our Children's Advocacy Center, which is another program of the District Attorney's Office, to train facilitators in our community to have conversations with kids and families about how you establish healthy relationships and coping skills. And so these are just some of our partners. As you can see here, we've offered more than 71 trainings at this point. We've trained over 5,000 people in our community, and we continue to bring these trainings and facilitation models to our community so that the work can continue beyond the grant cycle. So our third goal, right, we talked about this kind of multiple approaches, bringing awareness, bringing education, and then it was enhancing our service delivery system. For us at the Family Center, we were already established to house a program like this because we have diversion programs. We provide information, resources, and referrals to families across the county. And we really are a place, not a program. And what we mean by that is that any family that comes to the center, it's really meant to be an easy access point because we're grant funded. There's no eligibility requirement. We can be a front door, a back door, or a window to providing support to families without any of the typical barriers like insurance or eligibility criteria. And so when we were approached to be a partner in this initiative, it just made sense for us. This was another diversion program, right? If we can support kids when they're younger and help them build resiliency, they're less likely to be impacted by the negative social determinants of health as a result of their early childhood exposure to trauma. So I talked about information, resources, and referrals. Other programming that's offered through the Family Center that continues throughout the pandemic, and we'll get into how we adapted in a minute, are parenting classes. So we do evidence-based practice programs like families, nurturing families in recovery, nurturing fathers, parenting journey 1 and 2, and a variety of other evidence-based programs that teach parents and kids tangible skills to build resilience in their own family. We provide support groups like Grandparents Raising Again or Sober Mommies, which is an initiative to promote women in recovery. And then we partner with local experts like Learn to Cope, Hope Floats, and To the Moon and Back, who all have a very unique and important lens in the work that they do with children and families. And so I encourage you all to take a look at these after the presentation and get connected if you're not familiar, because they're just exceptional partners in community. Excuse me. So we talked about services. Now let's talk about what a referral looks like. Referrals can come in from anywhere. Our largest referral source, and you'll see it in a minute in a slide, is Plymouth County Outreach, right? So our recovery coaches in the community doing follow-up care with individuals who've experienced an overdose are our key partners. And having those conversations with parents who are entering recovery or caregivers entering recovery to let them know that there's a support network out there for their children. We do believe that recovery is a family affair, and we know that families come in all shapes and sizes. So it could be an individual at the beginning, middle, or end of their journey of recovery, parenting a child. It could be a caregiver. It could be a child in foster care or in the care of the department. We don't have any exclusion to the families that we serve. We just meet families where they're at, and we try to connect them to the services that are in line with their own family needs and culture. I think we mentioned at the beginning of this presentation that we partner with Plymouth County Outreach, and there are 28 police departments, and thus we serve 27 communities. One of the police departments is representative of Bridgewater State University, and so it's not an isolated community in itself. What you can see here from this slide is we've reached about half of our communities, which means we have a lot more work to do as we continue to engage kids and families. But we're able to collect the data because our Family Resource Center has a very integrated data collection system, much like an electronic health record. And so we look at where we're serving families, where those referrals are coming from, and what services we're providing to kids and families so that we can better advocate for financial resources in the future that are really driven by the needs of our community. And so we have more work to do in reaching our county, but we're off to a good start. Here are some of the services that we provide. So a child and family might be referred to us because they're impacted by parental or caregiver substance use. But what we found, much like any other clinical service, is that when you meet with a family and you start an assessment, it's just peeling back the layers of an onion. And we often find that families have multiple needs. And so you can see here a list of the services that have been requested by families that were referred to our DECI program. Now, we did all of that pre-pandemic, in person, live training sessions, live sessions with families at our family center in Brockton or our satellite in Plymouth, or at schools or community centers in a neighboring town, whatever worked for the family. And then we partnered with our learning institutions, our colleges, our police departments, our libraries to host training sessions for our professional network. But then the pandemic hit, and we had to figure out how do we do everything that we do live virtually. And so I'm going to talk a little bit about that. The first thing that we recognized pretty quickly is that families who financially kind of held their head above water, who never utilized financial assistance programs before, started to flounder. And so we saw an increase, more than doubled an increase of unemployment due to layoffs or furloughs. We saw an increase of calls for support around food, nutrition, and financial assistance. We saw increased calls for mental health and healthcare. This data was pulled from Mass 211. For folks that are not familiar, 211 is an information, resource, and referral line here in the Commonwealth. I'm going to date myself, but if you think back to your old yellow pages when you would pull out the big yellow book and you'd look for a phone number, Mass 211 does that. But they also collect the data. So if you're curious about what's happening in your communities, I encourage you all to go to the website, the Mass 211 website, and start to pull some numbers of your communities. We highlighted these communities that you see here on the EBT list because those also coincide with our communities with the highest rate of overdose. And so if you look at the economic hardship that hit our families, you can just imagine that the need for basic assistance support increased as well. Now, just like every other organization across the nation and really globally, we had to adapt to the pandemic and think about what were the factors we had to strengthen in our practice. We had to look at things like workforce development, our staffing policies, our ability to provide safe work environments, both for families and for our staff. And we had to adjust our projects related to prevention, intervention, and policy change because many of the activities that we engaged in were live. The photo here that you see is also one of our regular standing projects at the Family Center and Community Connections, which is our community magazine, a quarterly publication. And the volunteers really mobilized around the pandemic pretty quickly so that our spring edition was really designed to be a COVID-focused special edition that provided things like where's your testing location, what should we be concerned about. It also addressed the racial inequities in the system and how You'll hear a couple of stories from first responders about how they had to balance the challenges of supporting their family, working in a pandemic, and maintaining health and safety. So if you're interested in that, if you want to just check out that little barcode, the QR code in the corner of my backdrop, it'll bring you to our Family Center and you can check that out. But that's just another resource that we adapted pretty quickly to provide information to our community. We also had to expand things like technology. So we worked with the Department of Children and Families, which was our primary funder under the Family Resource Center, to be able to update our technology. We got laptops and cell phones and Zoom accounts and increased our ability and our knowledge to bring everything that we do live virtually. We partnered with folks like Pinnacle Partnerships in our community to get access to PPEs that we distributed to families. And we brought all of our classes online. We brought everything online. We brought individual supervision, our group supervision. This photo here is our DEC team. We meet weekly to plan the programming that we offer to our community. And it all happened in the blink of an eye. We also did some deep listening. We had to realize that if we were going to continue the efficacy of our programs, we had to continue to partner. And many of our groups really identified the issues of complex trauma, right? So we live in a community, we're in the midst of the opioid epidemic, we're looking at adverse childhood experiences and how ACEs are impacting our community. And now we had a whole system of kids that were either hybrid, remote, or not being educated at home. And as we prepared for the fall and we prepared alongside our teaching community, we heard from teachers and from schools that they needed more support. They really wanted to have a grounding in adverse childhood experiences, and they wanted a way in which they could talk about how to bring resilience to this new normal of the online platform of schooling students, engaging families, and supporting each other as colleagues in the work. And so we got together with our prevention coalitions, who you can see are listed here, developed a 2-hour training, and we called it Resilience in the New Normal: What Educators Need to Know to Care for Their Students, Their Families, and Themselves. It was very well received. I think we had over 200 participants for that day, but we also got a request for more. And so we took that request and we developed a monthly meeting. And we asked the teaching community what they wanted to hear in those monthly meetings, what would be most helpful for them as they were trying to manage this world of educating students. And so the list that you see here are some of their concerns, the things that were worrying them, the things that were coming up for their students, the things they felt like weren't available to them because they were no longer in the same building, in the same place, with access to all of their other professional developments. And so we developed this series facilitated by our school liaison that is available to all school community personnel, volunteers, crossing guards, bus drivers, superintendents, teachers, guidance, attendants. There's a variety of attendees that take advantage of this monthly meeting, and we're honored to be able to host it and facilitate these community conversations. Other projects that we had enhanced was initially we thought we were going to do a book buddy program, and we applied through the Community Health Network Alliance for a literacy grant. And we had an idea that we wanted to provide resources for kids and families and professionals to be able to build resiliency, to address some of the traumatic events that they were experiencing, to maybe start book clubs, or just have some conversation starters. When the pandemic hit, we had to reevaluate the hard copy book buddy program, and we were able to partner with Overdrive to establish the Resiliency Library. We encourage you to check it out. On there, you're going to find resources for social and emotional learning, building resilience, behavioral health topics, and just some really insightful, thoughtful books that were recommended by our subcommittee to gear conversations and bring information to our community of kids and families that we serve. Other things we adapted were, our in-person story times went virtual. We also got creative and hosted a Meet the Author with Jarrett who wrote this wonderful book, Hey Kiddo, and he talks about his family's experience being impacted by substance use and what helped him build resilience. And then we partnered with additional local experts, people in our schools and in our community doing great things, like Casey O'Brien, who developed this teaching guide to coach kids on relaxation and regulation and coping skills in times of trouble. So we really just listened to our community, and we enhanced what we had planned to do to offer it virtually or make skills and tools accessible to our community. In the midst of all of this, we were also in deep conversation with our department and children and families. And one of the needs that they identified was enhanced education for caregivers and kids. The first request came in the form of, how do we educate family and caregivers on their loved one's substance use? How do we talk to them and help them identify how they're being impacted, and give them some skills and tools and some language to start to address some of the issues that were impacting their family as a result of the substance use of a loved one. And so we launched a pilot program. We developed this curriculum in partnership with our prevention coalitions, our Department of Children and Families, and our recovery coaches. We thought maybe we'd offer it once or twice, and it was so well received that in the last 4 months, we've offered it 4 times. This is a 2-session program, so about 4 hours, 2 hours each session. And then we got the request for more enhanced knowledge-based and skill building. And so we developed a second series to this portion, and it's called Helping Kids Cope. And it's really conversation starters. How do you give kids a voice to talk about the impacts on them as a result of their parent or their caregiver's substance use? And so we've run that program once, and we're super excited to run it again later this summer. But so far, it's been really well received, and it's given folks a conversation starter, a place to open the door to create some safety and some compassionate conversations. Other things that we've done is partner, right? We talked about building localized capacity. And so in the first year of our program, we developed facilitation training for Balance for Kids, which is trauma-informed yoga. And so we partnered with Sabora, who's a Cape Verdean organization in the city of Brockton, and we offered this program in partnership with them twice live and once virtually. And let me tell you, we learned a lot about trying to do yoga with elementary school age kiddos virtually. Our clinician, Katie Mappa, who just went out on maternity leave with our first baby, co-facilitated this last session virtually, and it was absolutely wonderful to see the kids try to teach her Cape Verdean Creole and for Katie to try to teach yoga while pregnant virtually. They had a ton of fun. The point of this, though, is that everything we do is built on combating ACEs, right? So we want to look at the adverse childhood experiences impacting our kids and families, and then we want to build resilience around this. We don't want to just acknowledge all of the challenges and the complex trauma our families encounter. We want to build skills and tools, both for ourselves as stakeholders and community members, but for our kids and families so that we can work towards recovery as communities. Next up, another great partner is Calmer Choices. If you guys are not familiar, I encourage you to go to the website. There are a variety of free resources that will walk you through mindfulness practices, whether you're a teacher, a parent, or a community member. They have really taken this pandemic to bring all of their resources online. And when you get to Calmer Choices now, when you look around, it feels more like an online university than it does, just an informational website. They've done a fantastic job of teaching kids and teachers and parents and providers how to cope, how to be mindful, how to be present and in the moment during the time of the pandemic and beyond. And so we are so grateful to have Fiona and her team as valued members of our network of support. So Mr. Cruz talked a little bit earlier about Handle with Care. During the pandemic, this gave us prime opportunity to offer virtual training to law enforcement, fire, EMS, and school personnel. And so we gave our community a charge. We invited them into action. We provided information and training about what is Handle with Care. And then we engaged them in conversations about how do we become a community of care here in Plymouth County. And so now we're in the place where we are talking with each community stakeholders to establish themselves as a community of care. And what that looks like is they have a signed MOU between their schools, their police departments, their fire departments, and their EMS providers to communicate back and forth between the school and the first responders when a child's been impacted by a traumatic event. And so they'll have signed MOUs, they'll have practice protocols, and they'll have communication protocols that'll allow us as a community to be better informed, caring adults, supporting compassionate responses to children and families in our community. An additional partnership that's really enhanced our knowledge base as staff and that we're working to identify new ways to bring to our community is our relationship with UMass Medical School and their trauma initiatives. The UMass team has provided technical assistance to our family resource centers for the last 8 years here in the Commonwealth. And specifically in Plymouth County, more recently over the last year, they've helped us enhance our trauma trainings for providers. They've met with we talked about our Resilience in the New Normal group earlier. They've presented on racial equity and trauma in the context of schools and students in public school systems recently. They've worked to help us draft some educational offerings that we're going to be rolling out for parents and teaching parents about ACEs. And they continue to be a technical assistance partner and helping us work towards advocating that Massachusetts be a trauma-informed state. And so some of you on this webinar might know that we are one of 3 awardees for the OVC funding to provide DEC programming here in the Commonwealth. And right before the pandemic shut down, literally March 2nd of last year, we were able to come together with our friends over at the Worcester DA's office and their DEC teams in that community of Worcester from the Worcester Public Health and our friends at Wayside Youth and Families. And we presented on the value of making Massachusetts a trauma-informed state. And I think that kicked off a larger community conversation about how we each in our silos can be advocates and allies to better support kids and families as it relates to trauma. Last but not least, one of the places that we tackled, how do we share information, build awareness, and get resources out there, is that the district attorney's office put forth the energy and the resources to develop the Massachusetts Handle with Care website. This is our clearinghouse for Plymouth County and beyond across the Commonwealth, where you can find information, best practices, resources, and information about how we handle kids with care, what are best practices for trauma response, where can you develop allyship and community resources and stakeholders in your communities. And so we're very grateful to partner with the district attorney's office and provide a clearinghouse, a place where you can go to get information about bringing these models to your community. So for me, for us, for the district attorney's office and the communities within Plymouth County, we are very grateful to have presented to you today. And I think at this time, we're going to kick it back to Charlotte and Brenna to facilitate a question and answer session. Thank you so much, everyone.
Thank you, District Attorney Cruz and Melinda. So if you have any questions, feel free to put them in the Q&A function. We do have one so far. Are you working with local peer recovery support centers?
I think we are obviously through PCO, Plymouth County Outreach, when our police officers go to somebody who their homes that passed that had an overdose, they go with the recovery coaches and work with the local recoveries, whether it be the Champion Plan here in Brockton or whether it be East Bridgewater Hope or some of the other programs that we're all working together with. And also through our Plymouth County Outreach and our monthly task force meetings, we also bring in all different partners from the community. So I think that to that extent, we've been working hard with it.
I would just add, we also have great partnerships with our local hospitals. So Signature, BID, most of our major hospitals in the area are part of this network of Plymouth County Outreach. And so We encourage you to invite them, Charlotte, in the future to do a presentation about how they establish their intervention process. But just really quickly, PCO communicates with the hospitals when someone's been brought to the ER for treatment. Now, treatment is recommended and offered when an individual is at the hospital, but if they choose not to receive that while they're in the ER or at the hospital, that's what triggers the community response and the follow-up to offer individuals follow-up care in their home. And that's the trigger for law enforcement and recovery coaches to go out and offer treatment. And as part of that offering of treatment is also identification and placement in recovery units if that's something that the individual is in need of.
Are there any other questions? I'll give it about 30 seconds to see if there's any others. But I did just want to say again, thank you both for presenting. This was really informative and really great information for all the advocates and other people in attendance today. I'll just give a quick plug for our other upcoming events. Victim Rights Month starts on Thursday, April 1st. And Brenna might be putting in the chat the link to register for those other events. So if you enjoyed today, if you just want to see what other offerings we have, definitely check those out. On Thursday, we're kicking off the month with a Q&A with Tarana Burke and Attorney General Maura Healey. So we're really looking forward to that. Oh, we got one more question. What is your plan to continue working with other local police that are not yet involved? I noticed Marion and Matt, I'm going to pronounce this wrong, Mattapoisett was not on the list. Thank you.
Yes.
Wait, Melinda.
As we said, right, if they weren't on the list, that doesn't mean they're not involved. What that means that pie chart that you saw was where we've gotten direct service referrals. Mattapoisett and other I call them the cranberry cluster. So if you're familiar with Plymouth County, the southern part of our region is all cranberry bogs. They have been involved in the training for law enforcement to identify children at the scene in the trauma-informed practices training. They have a very active school resource officers that are trained in Handle with Care. We've also trained their EMS and their fire, and all of their schools have been trained in helping traumatized children learn. So that pie chart is a little misleading in that those were where we've received direct referrals from, requests for support for kids and families. But there are a variety of other ways in which we're touching those points in the county. I think it's always our mission to have boots on the ground and to be in those communities building relationships. So Mr. Cruz, I don't know if you'd add any more.
Yeah, thanks, Melinda. First and foremost, we've relaunched, Handle with Care because of the pandemic. We're just starting that up again. We were doing it again last year. But I think one of the interesting things of Plymouth County Outreach is that every police department in Plymouth County is involved in it. We have 26 towns and the city of Brockton. They've all signed MOUs. We are working with all of them. We're all sharing information. We're sharing data. And when I talk to prosecutors across America and they talk to me, how do you get all your police chiefs on the same page? I mean, how do you get all police chiefs to all agree that today's Tuesday? Because everybody has different issues going on with their respective towns and with their budgets and things such as that. But we're fortunate here that all the chiefs are working together and all the towns are working together. And I think that's what makes PCO so effective, that in conjunction with the Drug Abuse Task Force. Once again, nobody professes to have all the ideas. Nobody professes to try to say, I did this, I did that. It's really more of a collaboration and trying to work together to try to get in front of these problems here. So I think that if you take nothing else from us today, is that everybody here, I think down our neck of the woods, is trying to work together to make our community better, stronger, safer for our kids and for the next generation of kids.
Okay, well, I don't see any other questions. So I will just put the link to our other events just in case anyone is interested in those. And then there will also be an evaluation for this. I'll send that out. Oh, Brenna's ahead of me. She just put the link to all the other events in the chat. And there is an evaluation just to give us some feedback and how we can make our future trainings better. I'll include that in the email with the PowerPoint that will be going out in the next few days, along with the recording of this workshop.
Thank you.
Thank you both for presenting, and thank you everyone for attending. Have a great rest of your day and week.
You too. Take care, everyone. Don't
Bye
be
now.
strangers.